As of 2025, 41 states and Washington, D.C. have adopted Medicaid expansion, while 10 states remain that have not. These states include Wyoming, Wisconsin, Kansas, Texas, Mississippi, Tennessee, Alabama, Georgia, South Carolina, and Florida. States that have adopted Medicaid expansion have increased resources for men and boys' health, like more access to preventative screenings and other health appointments. Medicaid expansion is especially helpful for minority male populations who benefit from these policies the most in states that have adopted it. Health disparities in male populations in the United States are most commonly found in minority men and low-income men. These two demographics make up large portions of the states that have not adopted Medicaid expansion, meaning that many men are left without adequate health care in these areas. In Medicaid expansion states, young men have increased access to health insurance once they age out of the typical system. Medicaid expansion allows for non-elderly young adults ages 19 to 25 to remain eligible for Medicaid if they have an income 138% below the poverty line. Under the Affordable Care Act, this requires private health insurance to cover the children under their parents' insurance until they're 26, regardless of their income. Low-income young adults living in non-expansion states are unable to remain eligible for Medicaid under their parents after they have turned 19. This is why Medicaid expansion is vital for all states, because it helps address the insurance gaps that largely impact low-income individuals. Studies have also shown that young men are benefiting from Medicaid more often than young women. Since young men no longer are eligible for Medicaid after they turn 19 in non-expansion states, their uninsured rates increase significantly as they get older. For states that have not expanded Medicaid, there are currently 1.5 to 2 million people who are in a coverage gap due to the lack of Medicaid expansion. Adults in these coverage gaps are largely racial minorities, with the younger populations being mostly men and the older populations being mostly women. The younger populations, ages 19 to 34, being mostly men indicates that these men are unable to go to the doctor or seek other types of health appointments. Men have the highest rates for heart disease, suicide, diabetes, and other life-threatening diseases. Having access to physical and mental health services is very important for young men because it can help detect these diseases early on. Earlier diagnoses for certain conditions can mean having a higher survival rate and less damage done to your body. These young men in non-expansion states do not have access to these important screenings, meaning that if they are facing a medical concern, it will not be caught before it is too late. Medicaid expansion has helped millions of men receive access to care and life-saving screenings and diagnoses, which is why it's important to address the many men who live in states where it is not provided. Many studies have found that Medicaid coverage is not correlated with increased prostate cancer diagnoses for high-risk populations. Since the implementation of the Affordable Care Act, it has been found that white men are more likely to receive treatment for prostate cancer, despite African American men being the most at-risk population. Since the expansion of Medicaid coverage, there has not been an increased treatment for men with prostate cancer. This indicates that only expanding health coverage may not be enough to address different racial health disparities. Men's Health Network is a nonprofit that has many initiatives to limit racial health disparities among different groups of men. We recognize the importance and how groundbreaking the expansion of Medicaid coverage is for some people, but we also still need to work towards eliminating these health disparities. We believe that through culturally diverse education and community events, we can help limit the barriers that some men face to receiving treatment for prostate cancer. Medicaid expansion is supported by the National Alliance on Mental Illness because it will increase the amount of people who have access to mental health services. Men's mental health is a subject that has been talked about more frequently in recent years, but not enough has been done to help reduce the stigma. A main part of the stigma surrounding men's mental health, for low-income men specifically, is the lack of options and resources that are available to them. Low-income individuals are the people who hurt the most in states that do not have Medicaid expansion. Therefore, these men are unable to seek mental health care because they cannot afford it. Low-income men are more likely to be struggling with mental illness, stress, and substance abuse. Being a low-income individual in itself causes a lot of stress that can be very emotionally taxing and is something that people with private insurance or a higher income don't experience. Expanding access to mental health services will help break down the stigma surrounding men's mental health because it will help to normalize receiving treatment. If more men are able to seek mental health services because they are covered under the Medicaid expansion, then other men will feel less ashamed for doing the same. Medicaid expansion increases the amount of minority men that receive health coverage. In the United States, minority men are more likely than their white counterparts to be low income and without insurance. Medicaid expansion can help to limit these coverage disparities because most of the people who fall in the coverage gaps are minorities. With the lack of health insurance, minority men are unable to receive important preventive screenings like a prostate cancer exam. Not implementing Medicaid expansion will contribute to the higher death rates of African American men with prostate cancer because they will be unable to detect it early. Minority men also experience increased stigma and medical mistrust more than white American men, meaning that they have more barriers to overcome than just receiving health insurance. Even though simply having health insurance will not completely diminish the stigma and medical mistrust African American men face, it can be a place to start. Without health insurance in the United States, many of these men will never be able to afford a yearly physical or life-saving procedure even if they wanted to. Implementing Medicaid expansion can be one of the first steps to decreasing the coverage gap and ensuring that minority men have the same health outcomes as white men. Medicaid expansion has been implemented in all but 10 states across the country. Studies have shown the improvements in patient coverage in states with the expansion when compared to states without it. The majority of people living in non-expansion states that remain ineligible for Medicaid coverage happen to be minorities. This indicates that Medicaid expansion would mostly benefit these minority men who are uninsured and unable to receive coverage. Minority and low-income men are at a higher risk for mental illness, substance abuse, and mortality for other illnesses. If Medicaid was expanded in these states, these populations facing these health disparities would have more access to quality care.